So if you clicked on this video, there's probably some lump, mole, bump, little black mark spot somewhere on you that's got you a little concerned because you clicked on a video that said signs of melanoma on it. It's important that you kind of know some of the things that might make you lean towards really getting to the doctor faster. So I'm going to share with you the ABCDEs, the 5 things that they actually teach doctors in medical school to look for when we're trying to figure out if something might be a melanoma. My goal here is that you might speed up how fast you get to somebody if you see some of this stuff. And so it's important that we go through it. First of all, A for asymmetry. What is asymmetry? So if you drew a line right down the middle of the bump that you're talking about, if it would then be different on either side of that line, that is asymmetrical. And that is one of the signs. That's the A of the ABCDE for melanoma. B is for border. Border says if the border is all irregular, if it looks squiggly like an amoeba or like one of those Rorschach drawings, those ink blot drawings where the border is everywhere, it's not a circle, it's not an oval, that's a sign that there might be some more risk of a melanoma there. C stands for color. If the color is very irregular, there's some brown splotches, there's some clearer splotches, there's some black splotches. If the color is all over the place, that's another sign that it's more risk for potentially being a melanoma. D stands for diameter. That's just the size, okay? So 6 millimeters is the line at which point the American Academy of Dermatology starts saying that you kind of be concerned. 6 millimeters is about the width of a pencil, so you think of like a pencil eraser. If it's starting to get bigger than that, that's another thing that would lean you towards you need to maybe get to a physician faster and get it looked at. E stands for evolving. Some folks like to say enlarging. I've heard some folks say it, but really that's for changing. So if this is evolving over time, if this is changing, if it doesn't look like it did last year, that's a good sign that you might want to get that checked out. One of the things that the American Academy of Dermatology puts out is a skin check form. I'll include the link below. You can download that and you can do annual checks or periodic checks for yourself and you can keep track. That way you don't really have to remember what it looked like 6 months ago or a year ago. I have trouble remembering what I ate 3 weeks ago. Hard to remember what every single mole or freckle on my body looked like. So this is a way that you can have some objective information to share with your physician. So earlier in the video, I promised you a link where you might be able to get a hold of some free skin check resources from a dermatologist. There's a program called Spot Me. Right now it's a little bit more restricted because of everything going on with the coronavirus, but as that starts to relax, the American Academy of Dermatology will often do free skin check events, and I'm going to give you the link where you can look and see if there's one coming up in your area. Remember, don't wait for those. If you've got something that looks concerning on your body, please get to a physician immediately and get it looked at.